Yes. Hi, everybody. Thank you very much, Arohi, for this wonderful introduction. Okay, I'll just take it one step forward, and I would want to use this opportunity to speak about our hospital, that is the hospital. Okay, we are put up in Kanakpura Main Road. Okay, it's right next to the Kalsandra Metro Station, right? And here we have a department of family medicine where I'm the lead consultant here, and Dr. Ramakrishna Prasad sir as well. Right, and moving forward, okay, this as you all can see, we are family medicine specialists. So do any one of you have any I mean, have you known any family physicians so far? Have you heard of this specialty called as family medicine specialty? Can somebody, like, no, you can leave a message on, or just a thumbs up or something, in case you know, or unmute yourself and if you want to say wonderful. Okay, I see that one knows, but there are so many knows, as I can see. Yes, it's a very less known specialty in India, while in all over the world, especially in the advanced countries, okay, family medicine doctor is the first go-to doctor for any family, right? So we have, like, how all of you can know, there are so many specialties, like you all are familiar with cardio, neuro, nephro, whatnot, for every organ, like your respiratory pulmonologist, rheumatologist, even psychiatrist, right? There are so many specialties, but what you can see is that a person's body is not, it cannot be dismembered as per the system, because a person is always seen as a whole, right? So whenever there is heart related issue, you go to a cardiac doctor, and then you develop a renal issue, that is a kidney issue, you go to a nephrologist, and there is no connecting line, there is no connecting dot, and the person feels that the care is not continued, it's not comprehensive, that this doctor sees me for this particular ailment, but the other doctor of mine does not know anything about it. He says that whatever it is, you follow with that doctor, and the other doctor says that whatever the issue with your nephro, you please follow with this nephro. So there is no connection, and this is what our specialty of family medicine is all about. Unlike other specialties, we are not limited to just one organ or a disease or a body part. We see a person as a whole. Okay. Also, the other thing that I would want to say is we give care across the whole continuum of your whole lifespan. That is from the cradle to grave, like we call as, right from the newborns to the seniors. And we are the specialty where you can have this one single doctor for all the members of your family, say for your grandparents who are elderly, bedridden, to your parents who are likely to on their journey towards being elderly, to yourself who are in the middle aged, and to your spouses, if you're if you, your wife, your sisters, and also to your kids. Okay, we see and provide our care to across the continuum, and it would be a more comprehensive care where we are specialized, and we, our specialization is that we are trained to see all of these things in a person, right? So like how I've put in the slide, family medicine is a medical specialty with primary care that provides a continuing care. Often you have a family doctor for your lifetime, that one single go-to doctor whenever there is a medical emergency, medical issue, medical crisis that occurs in your family, right? And we provide a comprehensive care. It's not limited to your body part. You come with a headache, I don't just say go to neuro. I treat your headache. I see to it that is it due to any other reasons. Headache can be due to various reasons. It can be due to your BP fluctuation. It can be a stress-related headache. So I cannot say if it's a stress-related headache, go to your psychiatrist. No, I would, sorry, I got a message. Please start with the, sure. Give me just 1 minute. I'm done with this. Okay, yes, so this is about our specialty, and we provide care across the continuum. Now, diving on to today's topic, that is how to be a first level responder for the medical emergencies around you. Can you please change the slide? Whoever has the control, Arohi, perhaps. Yes, next slide, please. Next to this. Yes. So today, what are we going to learn? Sorry, to the objective slide, please. Today, what are we going to learn is what's an emergency and a few common medical emergencies that can happen around you. And then how can you be a good first level responder during these emergencies? That is, what can you do effectively, especially what not to do during some emergencies, and when exactly to call for a medical help, right? Next slide, please. So what is a medical emergency? Usually when we think of a medical emergency, it's usually with these images that you can see. There is a red alert everywhere, then there's a person who has fallen down, then there's a medical team that comes and shovels him into a ambulance, and then he ends up in a hospital with a lot of monitors around him, with a lot of wires from all the places, and one anxious looking nurse, right? This is the picture that usually comes to our mind. But is this called as an emergency? Is this the only definition of emergency? A serious, unexpected, and often dangerous situation involving illness or injury? No. Okay. Emergencies can vary. Definitely, this is a medical emergency, but there are so many emergencies which can be managed by a very good first level responder by providing a first aid, right? And that comes with a lot of understanding, okay, because it has to be the medical guided way. That is due to I mean, when you follow certain protocols, it will be very easy. This will make a difference in saving a life or causing more harm, right? So a few of you can actually put it in your chat box as to, whenever there is emergency around you, what could be that reason that you do not go ahead and help that person? I'm just curious. I just want at least 2, 3 of you to actually, just put out your responses for this question. Most of the times when there is a medical emergency, nobody steps forward. Lack of knowledge, no idea, right? Yes. Huh? I don't have the knowledge about what to do, what might happen, tensed, don't want to harm. Wonderful. Exactly. Most of the time we think that it's because of an ignorance, but no, this is because there's a lack of understanding and lack of not knowing what to do or how to do. And most importantly, will I cause more harm to that person? So let the medical team come and help. So these are few things that as a common person, people will usually have this in their mind, right? Please, yeah. So who can be the first level responder? First level responder need not have to be a medical person, need not have to be even a science background person. A person who knows few things, as how you will be told about once we are down through this webinar. Okay, if you follow a few things from this, definitely you are well equipped to be a first level responder, right? Literally anybody who has few basic knowledge in the medicine, that is by attending such webinars, by having a BLS, that is basic life support classes, definitely anybody can actually be a first level responder. And what can you do when you see a medical emergency happening around you? Just the three things, three important things out of a huge exhaustive list. Prevent further injury. You do not want that person who has already been a victim to have further injuries, right? So you need to prevent further injuries from happening. You have to preserve life, and then you have to promote recovery. These are only the three main P's that you need to do as a first level medical, that is first level responder. Please move on to the next slide. Hello? Arohi?
I've changed it, doctor.
Okay, it's reflecting now. Okay, emergencies can happen anytime. Following a systematic approach when there is a crisis is very important. So in case of any emergency, even before rushing towards the patient, there are a few things that you have to bear in your mind, and your safety always comes first. Okay, so how do we take these safety steps? First thing, we need to stop and assess the situation. What has caused that person a danger? If it's a heart attack, it's something which has occurred internally. If it's a snake bite, there could be something which can harm you as well. Or if it's an electrocution that is happening, electric shock, if you go blindly touch that person, even you will end up having the electric shock. So a danger can be in any possible ways. So first you need to watch out what could be the probable danger around that site. Okay. And once you make sure that there would not be any danger if you go into to help the person, then you sure make an entry to the scene. See to it that it's safe. There are no sharp objects around. There are no live wires around. There are no slippery surfaces around, and all those things. And then you assess the victim. Now that the victim is there, collapsed, or he's unconscious, where you can actually talk to him. okay, and assess the victim as to how is he doing, and then call for a help. If you, in any case, in most of the cases, if the patient is able to talk, able to reply to whatever the questions you ask, then it would not have made much of a damage to the person. But where a person is unresponsive, or not answering to your question in a right way, like say, hi sir, how are you doing, like, no, are you okay, and he mumbles something, definitely there has been some harm to the person. Okay, and you need to call up for help immediately. In Karnataka, the number what we have is 108 is for ambulance. Okay, so that will dispatch the nearest ambulance so that the medical team can arrive and help the person. And in case some person is not responsive, there are few other things which I will be telling when we see a person who has a chest pain, right? Okay, that is where we need to resuscitate a person. Let us discuss regarding this sixth point a little later. Next slide, please. Okay, so few topics of interest that was given to me by Plum team were these 10: burns, heart attack or chest pain, deep cuts, heat stroke, electrocution, bee sting, fractures, choking, seizures, and trauma to the eye. Next slide, please. So first topic is burns and scalds. We'll just have a brief about what is a burn, what is a scald, because they are usually interused, interchanged. Though they produce the same result on the skin, they actually vary by the mode that it occurs. Okay, burns are caused by dry heat, such as fiber or a hot metal, or contact with an object, okay, charged with a high tension electricity. Okay, where scald is an injury caused by a moist heat, like a boiling water, boiling milk falling on your skin, a steam when you open something which is boiling and the steam is out, you put your face directly onto it and there is a burn that happens. That's a scald. Okay, a hot oil that is poured, a hot tar has been fallen on your skin. So all these amount to scalds. Okay, next slide. So what do you do when you see this? So even before we get into what to do, okay, I'll just quickly brief on the 3 degrees of burn that we call as, like, for you can say as a superficial burn, which is very involving the topmost layer of your skin. Usually skin has 2 layers, that is dermis and epidermis. Epidermis is the topmost, dermis is the deeper, and the third one is a subcutaneous tissue. Though it is not a part of the skin, it is beneath, right beneath the skin, with a very close proximity. So first degree burn, in a superficial burn, what we see is the topmost layer, that is the epidermis, which is burnt. This can be seen or visualized as something red, very painful, and usually there is no blister. Blister is a bubble that you can see in this particular image, where there is a big water-filled bubble on the hand. That is a blister. Okay. First degree burns are very mild, and it does not require any active medical management, except the things that I will be just explaining in a while. Okay. Second degree burn, it affects both the layers of the skin, that is your epidermis as well as dermis. Okay, and this can result in redness, swelling, and blistering. Blistering itself shows that both the layers of the skin are affected, so that can as well be a little deep, so it has to be attended with cautiously. Okay, and the blister should not be bursted at any point of time. It's like a protective layer for you. And while we come to a severe burn, in spite of its name being having severe in it, the patient usually does not complain of any pain, because even the nerve endings would have damage. So the patient does not appreciate any pain, while the skin will look very tough, leathery, whitish, like as if there is no circulation at all in the skin. And the underlying structures like bones and few tendons and muscles also can be visualized. That is a severe burn. And in severe burns, again, there will not be any blistering, right? Okay, so now what do we do when we see burns? Okay, first is, as a first level responder, we should not immediately run and handle the affected area unnecessarily, and especially if our hands are not hygienic. Okay, that can cause infection and that can spread very badly. So once your hands are clean and washed, you need to take that person's hand and run it down under a running water. Keep it down under a running water. Okay, in case of first degree and severe degree burn, it's okay, but in the second degree burn, you should make sure that the blister is not disturbed, it does not burst open. Like I said, blister is like a protective area. It actually lessens the damage that is caused by the heat. Okay. And then we cover this area with a sterile cotton cloth. Okay. And we are not applying any sort of lotion or powders or anything on that, because that can cause further damage. These particles can go and get embedded into the burn wound, and then that can give rise to infection. So we are not applying any lotions unless it's medicated and advised by your doctor. Okay. And we are not supposed to remove the burnt cloth in case somebody has a burnt injury where their cloth is also burnt and it is stuck to the burnt side, the burnt place. Then you're not supposed to remove the cloth from there, because that can remove even the vital tissues from there, and the wound can get much deeper and is more prone for being infected. Okay. And if the extent of the wound, like if it's a severe wound and if it's covering a large surface area, then the worry is different, especially when there has occurred a cylinder burst. If there is any no sudden short circuit and the whole house or the shop burns, and the person has sustained injury to face, back, hands, and everything, then there is a severe extent of burn where it is presented in most of the parts of the body. Such person has more complications that can occur, where immediate medical attention would be required. All right. In any concern in the chat box, what I'll be doing is I'll be reading all these chat box when we are having this interaction in the end of this lecture, so that I can answer to all of your queries. Right. Next, please, next slide, please. Arohi? Yeah. So chest pain. Chest pain is one common thing. Even before I started a lecture today, the webinar today, I already had a couple of people who said like chest pain in the middle of the night, and no, we didn't know what to do. Right? Somebody else said we thought it's chest pain, then it was a stroke. So first, let us get into what is a chest pain. Exactly what happens when there is a chest pain. That is, what is a chest pain? How does it manifest? That is, what are the symptoms? And then how to deal about it. Right? Chest pain occurs when heart is a structure which gives blood supply to whole of your body, right? But heart also requires some blood supply, and that has to come through proper channels. It not just because it's pumping does not mean that it's already getting a blood supply. Okay, there are a few channels through which it has to go, and the heart also needs to get a supply. Yes, I'll be speaking on choking as well. Okay, so what happens is when there is a block in the heart which causes the blood to not supply to the heart muscles, then a person develops heart attack. That is myocardial infarction. This is one case where a person can present with chest pain. The second common scenario, which is usually missed, where a person can have similar chest pain, but it's not a heart attack, but a precursor to heart attack. That is, which can cause heart attack, which if not corrected is a arrhythmia, where your heart is not beating in a proper rhythm. Okay, it has to beat in a rhythm, lub dub, lub dub. That is how it's supposed to beat. Okay, when it's not doing that, when it's just quivering around and not producing enough pressure for the blood to be pumped out of the heart, that's called as an arrhythmia. And this condition also can present with chest pain and multiple other symptoms. Okay, a few common symptoms that we can view in a person who is having heart attack or arrhythmia are chest pain, very severe tightness in the chest as if something is squeezing or crushing their chest. There is pain and discomfort that spread along to their left side of the shoulder, because heart and the left part of your hand has a similar nerve supply. Okay, so the pain can go radiating down your left arm. It can even spread to your jaw, to your shoulder, and even in between your shoulder blades in the back. Okay, there can be some nausea, vomiting sensation, heartburn, abdominal pain. Okay, chest pain, heart attack need not always have to be chest pain. It can be even abdominal pain. A few cardiac impulses are sent even down there in the upper abdomen. So it can even present like a gastritis. Okay, then there is definitely difficulty to breathing. And then there is definitely lightheadedness, dizziness, fainting, sweating, etc. Next slide, please. So what to do when you see a person with chest pain? What do we do? Okay. Again, we are not supposed to forget the safety slide that I put up. Okay. First, you need to make sure if the scene is safe. Is it safe if you have to go near the victim? Is it safe? That's the first thing. Okay, check for the response from the patient. See, tap on his shoulders and say, hey, are you okay? Are you okay? Right? This is what typically all of us are, made to rehearse so many times in our ACLS and BLS class. Okay, so we ask him, are you okay? And then once he does not respond, we immediately call for help. Either we shout out, if we see a crowd around, we shout out saying that, hey, please call for help, call an ambulance, right? Or if there is nobody around, if it's an isolated area, you can make use of that few seconds, dial 108, ask for the ambulance to come down, and then immediately position the victim on their back. They have to lie straight on their back. Okay, because that is a position where you can help him or her to actually get revived. Okay, and then you need to look if something is obstructing in their mouth for the airway, if they are not able to take the air, something wrong with the nose or the mouth. If you see something evidently wrong, try to remove it. Okay, second thing, are they breathing? Can you see their chest move? Third thing, is the circulation there? Gently, you can feel for their pulse. Ideally, we think that, can you all see my hand? Because I cannot see myself in this recording somehow. Anybody, Arohi, can you confirm me if you can see my hand? Wonderful. Thank you, Neha. Thank you. So you usually check for your pulse here, but when a person is down and unconscious, this is the place where you want to check. All of you can actually do this. Take 2 fingers of yours, okay? Keep it on the center of your neck here, near the Adam's apple. We usually call, there's a prominent bone here, okay? And simply slide your 2 fingers into a groove here, okay? You suddenly find a depression here, and this is the place where we can actually appreciate the pulse. This is called as cardiac pulse, that is carotid pulse, okay? And when you keep your fingers here, take at least 5 to 10 seconds, and you can see that it's beating. Your fingers are raised and you can feel the throbbing sensation. Okay, so that is your cardiac pulse. Okay, so you have to look for that. If a person is not having that, that means his heart is not pumping. Okay, many a times we feel somebody who is just lying on the wonderful. Thank you, Neha. You can feel it beating. Wonderful. So many a times, whoever has fallen down, we think they might have a cardiac arrest, especially if you have not witnessed them falling, right? But it can as well be due to intoxication with alcohol. They have just lost and have fallen down, or it's something else. So this pulse rate is something that differentiate. Okay, if somebody is having a heart attack, they will not have a pulse. While if somebody is intoxicated due to alcohol or some other drugs, they'll still have pulse. It's just that they're out because they're under the influence of that particular drug. Okay, so once you know that they are not having a pulse, that means their heart is not beating. That is when you need to give chest compression. Just wait for a minute. I have a small video on that, so that how to deliver chest compressions will be seen in that video. Okay, though not in detail because this is a webinar covering a lot of things. I could not elaborate much on chest compressions, but I have a small clipping where you have fairly some idea regarding that. Okay, and if once you start this chest compression, you now what we say is you don't have to give any mouth to mouth respiration or anything, just chest compression. If it's done in a right way till the medical help comes, you can actually save a life. Okay, please keep this in your mind. And if the patient is conscious, this is when a patient is unresponsive or not conscious. If a patient is conscious, give them sips of water and ask them to relax. Okay, let them be lying flat on their back, but give them, like, just elevate their head and give some sips of water. Okay, somebody is unmuted. Want to talk something? All right. Okay, give some water and ask them, like, are they feeling better? Usually, if it's a non-cardiac chest pain, a chest pain which is not due to a heart attack, will subside on its own. It might take about 5 to less than 20 minutes to actually come under control. But if the person says even after 20 minutes that the pain is still there, and no, he's developing the other symptoms that we discussed in the previous slide, then you will have to rush him to the hospital immediately, nearby hospital, to get an ECG and then for further management by the medical team, right? So please play the video, Arohi. Can you play the video, please?
I'm playing it, Dr. Amrutha.
To save a life
Sorry?
is easier than you might think.
I'm playing it. Is it not playing?
It's playing. We can see that.
Okay.
Yeah.
If you see a teen or adult suddenly collapse, it's important to act fast. Helping to save a life is easier than you might think. Just start hands-only CPR.
We are not able to hear, but we are able to see. The sound is not there. Right? Okay. So as this video is going, I'll just have a see. Now you see there's a person who is just down in a park, and as you can see, there is nobody around. So this person, though he didn't follow all the steps that I mentioned, okay, so he realized that that person is not breathing and probably there is no pulse. So what he did, this is something called as hands only CPR. A CPR full form is cardiopulmonary resuscitation. Okay, so where you stimulate your heart and your lung so that you get back the life. The video is playing again. I think we can move on to the next slide. I'll just make a few, I'll just explain it, right?
Yeah.
Okay, so what happened? So this person arrived. Let us assume that he has searched for all the danger and all the other things. Okay, wonderful. I'm just coming to the point. Pressure applied and other things. Okay, so you find this person. He made a phone call for the ambulance to arrive, medical support to arrive, and then what he did? He opened the chest area and he placed his hand, especially heel of the hand. Like all of you can see, this is the heel of the hand. Okay, onto roughly it is between the two nipples. Okay, the nipple line, what we call as in medical terms, it has to be in between, because your heart, though we say it is positioned in the left side, it is actually in the middle, more towards the left, and definitely not just in your left side. Okay, so ideal position between in between the two nipples. Okay, in the center region, put your heel on that spot. Okay, and then put your other hand over this, and then you give the compression. And the way of giving compression and how much pressure to put might not be shown in this video, but ideally your hands have to be straight. You have to be putting pressure from your shoulders and not from by bending your elbows and only in the hand. Okay, so maybe this topic, if many are interested, maybe we can have a webinar just on this, so that we'll have more awareness on this. But I think with this explanation, is it okay? Do you are you all no understanding regarding this? Yeah. Okay. Thank you, Zainab. Thank you, Neha. Right. Okay. So hands only CPR. No matter what, you do not know any basics. Just put your heel of your hand over the mid of the nipple line, internipple line, and then give compressions. Keep pressing it. Ideally, we say it has to go down by 5 centimeter. The chest has to go down by 5 centimeter and should recall. Okay, that is how it's supposed to be done. If most of you are interested, it's not per second. It's actually a little bit over us. I mean, less than a second, because in 1 minute, you are supposed to give at least 100 to 120 compressions. So as we know, 1 minute is 60 seconds. So if we say in 1 minute, we have to give 100 or 100 to 120, then it approximately comes to, in half a second, you have to deliver one compression. So 1 minute, 1 second should have two compressions. Okay, wonderful. Somebody, yes, Anu, yes, you're right. 1 minute is equal to 100 to 120 compressions. Wonderful. Okay, so there's a lot of things like this, but then please please have this in your mind that this can actually save a person's life. Okay, so whatever the heart has stopped beating, when you give these compressions, the heart can actually be woken up, and you can make the heart to beat. Okay, by the time the medical help arrives, and you have actually saved a person. This makes a lot of difference between life and death. Okay, please, next time you find somebody who's having a heart attack, who's been unresponsive, after covering all these things, assessing for danger, the site, and checking for the response and everything, please give him this hands only CPR, that is only chest compression, till the medical help arrives and you have saved a life, right? Okay. So let us move on to the next topic, that is wounds and cuts. Okay. So in this picture, I've just put you a nice looking wound, but trust me when I say wounds are not like this, and I mean it. Okay. You see blood all over. Even to know what area has been actually having a wound, we have to wipe out all the blood and then find this wound. Okay. This is a very clean looking wound because they've cleaned up the whole thing and they've stopped the bleeding. Otherwise, the wound never looks like this. Okay. So in wounds, you can have a clean cut wound, which is less likely to be contaminated. That is less likely to be dirty. The second is a rag wound, where the edges are not rough. It's somehow they've cut through some rough surface where the ends are not clean. They are all rugged. Okay. And the third would be a puncture wound. You have been doing something and something hit you. It's like a puncture, and then it has passed through and through. The puncture wound, the very important thing that you all should know is puncture wound, they might have a small opening, but they can really penetrate very deep. Okay. So that is where when it penetrates deep, it would have damaged some vessel through which the bleeding can be more profuse, and you will not know where is the bleeding occurring from. Okay. It's equally important to know regarding puncture wounds, right? Next slide, please. So what do you do when you see a wound? Okay. So when you see a wound, first thing, keep the patient in a suitable position for him and elevate the injured site. Okay. If my injury is in the hand, I elevate it above head so that the blood circulation reduces a little, so that the lot of blood is not lost. Okay. Unless it's a fractured limb. Fractured limb, let us come to it once we are down the slides. Okay. And do not disturb in case somebody has happened to bleed and there is a clot formed. You can see one red bubble of blood on it. Do not go to disturb it, because this is holding the fort for you. The minute you dislodge the clot, then your bleeding will start. Okay. If a clot is formed, please do not disturb a clot. Okay. And remove as little clothing as possible. Say I'm wearing a full armed, full sleeve dress, and I've sustained some injury because of some glass has cut my hand. Okay. So when I'm moving it up, I need to be very careful, because that cloth, moving it can disrupt the wound more, and it can extend the injury. If it's 1 centimeter or 1 inch wound, it can be 3 to 4 inches wound if you are moving the cloth sometimes. Okay. So please be careful. Move it a little as possible, just to visualize the wound if necessary, wherever necessary. And in case there happens to be some glass pieces or some other foreign bodies which are embedded into it, and you can actually see it, you can remove that, but not otherwise. Somebody, is it okay to perform CPR on someone with a stent implanted? Let us address all this in the end of the webinar. Anita, I'm sorry. Is that okay? Right. All right. Okay. So remove any foreign body that is there. Okay. And then apply pressure. Sunita had asked me, why do we have to apply pressure? Apply pressure, especially in bleeding wounds, was that pressure is a very good mode to achieve hemostasis. Hemostasis is for the blood to actually start clotting. Okay. So I think Pratik, this we can take it in the end. No point in you sending messages again and again. Your girlfriend is having a chest pain. Let us discuss on that in the end of this webinar. Okay. Please do not repost the same questions. All right. Okay. Apply a clean bandage on that, and then immobilize the injured part. Do not meddle much with the injured part. And then if the cut is, usually the bleeding should stop within 2 to 3 minutes, or at the max within 5 minutes if it's a bigger wound. If it's not happening even after that, it's stopping when you're applying pressure, but once you release the pressure, you're noticing the bleeding. That means the injury is much more deeper. So that definitely requires immediate medical attention. So you need to, after doing this first aid with all the things that you have done, you have to take this person to a hospital, right? Okay. Next slide. Right. Next slide is about heat stroke. Okay. All of us, I mean, especially this summer, I had quite a few patients of mine who came with heat stroke, probably because the weather was very extreme, like hot this time. Many people with heat exhaustion, which is a milder form, and heat stroke, which is a very severe form. Okay. So heat stroke, what happens in heat stroke when your body is exposed to very high degree of temperature outside and it's not able to cool down on its own internally, that is called as a heat stroke. Usually we all have that mechanism. Once our body temperature raises, we have certain fat called as brown fat and certain skeletal muscles which shiver, and then it cools down our body. That is a mechanism. Okay, when that does not happen, a person will end up in heat stroke. This occurs when a person is in hot environment doing some work for a long time. They can experience heat stroke. Okay, and this can be very life threatening if it is not addressed immediately, because this can cause brain damage due to high temperature. And other vital organs, that is your liver, your kidney, your heart, also can be, sorry, can heat stroke cause heart attack? Maybe, yes, possible. Not that it has to, but there is a possibility, right? Okay, next, symptoms of heat stroke. Okay, so heat stroke, how do you know if a person is having a heat stroke or something else, right? First thing, they'll be very hot, very hot. You cannot just say that, oh, it's something like this. Assume that a cooker, hot water is boiling and you go to touch the vessel. That is how hot they will be. Okay, more than 104 degrees Fahrenheit. Okay, and the skin will be very dry. Usually our skin is supposed to be moist, be dry. Okay, the body temperature will be high. Like I said, there can be headache because there is severe dehydration. There is no enough water in the body. That can cause headache. There can be rapid heartbeat, and when the rapid heartbeat happens, this can result to your arrhythmia causing chest pain. Okay, somebody asked, this is the mode that it can happen. Okay, rapid heartbeat, because body is trying to pump blood more so that it gets cooled down, the body gets cooled down. There can be dizziness, there can be agitation, there can be confusion when there is no enough, and when the body is not maintained at a right temperature. Any of this can happen. Seizures can happen, they can have convulsions, they can have fits, there can be hallucination, like mumbling something, imagining that something is there, and no, representing like somebody who is actually under influence of a drug or something. Okay, what do you do when you see such a person? Get this person, first thing, remove him from whatever the heat source it is. If it is an open ground, bring him to the shade. If he's in front of some incinerator, very high temperature machinery areas, bring him out from that surface to something shady and cool place. Remove the clothing, especially on the chest and abdomen and the arms and the legs. Okay, and then apply cool water or water packs. Okay, especially to the groin and the armpit, because those areas actually monitor the core body temperature. Okay, and have a person lie down in a cool area with slightly elevation. Okay, slight elevation, especially with their legs, so that what happens when we, such people are very prone to go into shock is called as some cardiovascular compromise, like no nutrient supply, no oxygen supply is happening in the body. That situation is called as a shock. Okay, so when this happens, it's always better when we elevate the feet end so that the blood supplies to the vital organs like your heart and your brain. Okay, this prevents the damage to these organs. Okay, and then cool the person rapidly as possible, but this does not mean pour all the ice that is there. Okay, especially more than ice, it is the room temperature water which can actually cool down a person, and then immediately call for help, because this will not just end there. This is just a first aid that you can do, but he would definitely require an emergency admission, and then the medical team will take care of this person. Okay, next slide please. Electrocution. Okay, a funny looking picture. Okay, yes, these days we are all very used to plugging the mobile in and speaking over a phone while it's charging, or it can be like without knowledge go and touch some switch and get a shock. Earlier days it used to be the boiler being the culprit all the time. The metal boiler that you had would often deliver a lot of shock to people. Okay, these days we do not have, but we have these other things like your mobile phones and other things. Okay, so whenever there is an active power output, whenever you're plugging something in, please be cautious. Okay, try to see if there are any signs of electric what do you say incapacity there, because usually such plugs have some black charred marks on it, because it would have already developed a shock and fire spark which would have damaged the surface. Okay, first thing, make sure of that. Okay, second thing, never plug in your mobile phones and talk. Okay, it's a very bad thing to actually talk when your mobile phone is charging. Okay, so how can you get electrocution? It can cause by touching any live wire or naked wire or a cable or a railing that has fallen down. Very common in construction sites. Okay. A shock can be relatively mild. It can be a brief shock, or it can be a very extremely severe shock where you are actually thrown out from that place. Okay. And then this can actually cause some burns, which are very deep and severe, especially with the high voltage. Next slide. So what do you do when you actually see a person who is having a shock, right? As a first level responder, you do not hurry and try to hold that person or try to remove him from the source, because human body is a very good conductor of electricity. Okay, so you doing that will be compromising yourself, and you will also fall a victim to that. First, try to switch off the power supply. In case you cannot figure out where is the power supply, take something iron, okay, and try to, sorry, not iron, wooden object, and try to hit that wire so that there is a discontinuation of the wire. The wire is broke. Okay, that will cut short the power supply. Next thing is remove the patient immediately. Now that he is not exposed to the active electric shock being delivered, it is safe for you to go and touch that person. Once the electric supply is turned off, it is safe for you to go and touch that person. Okay. And then you remove that patient from the site. If it's a mild shock, usually the patient would be conscious. He will be responding to your questions. Okay. Wherein you can actually reassure that patient. Okay. And ask them to just lie down and with their head and low. Like I said, any shock, make the person lie flat. Okay. And elevate their foot end. Okay. So that the blood supply occurs very much right. Okay. Then loosen the clothing around the neck and chest so that they can actually breathe in properly and there is no obstruction at the neck level or the waist level. And wrap them up in a blanket, because it's very common after getting a shock, suddenly you start feeling cold, because there's a lot of mechanism that happens in your body once you're revived from a shock. Okay, so give them a blanket to make them comfortable, and maybe a sip of water also. But in case there has been some extensive injury where you see the person is bleeding or the person is unresponsive, please, once you remove the patient from there after turning off the power supply and placing in that position with foot and elevated, call up the ambulance and be with the patient. And whenever the bleeding is there, please go back to your previous slides where I've said try to put pressure whenever there is bleeding and other injuries, right? All the first aid things, they're all interconnected. You have to just use all the information that is there when you see any emergency, right? Okay, next slide, please. So bee sting, okay, this is very good. Have any one of you had a bee sting? Please, you can just raise your hand or comment on that if you know somebody. Wonderful. There's one person who said yes, yes. Oh, so many yes. Wonderful. Was it very severe? Was it very severe? Did you have to be rushed to hospital? No, no. Wonderful. Very good. So many answers we're saying no. This is what I want to not tell. Okay, the venom that is injected by a bee is very mild for a human body. It is targeted only for another insect of its own size. Okay, it's definitely not meant for this huge human body. Okay, the venom is very small, very less in quantity, and it cannot harm the human body. It can just produce some local reactions. Okay, it can be like local pain wherever it is bit. Okay, and there might be some redness and swelling. But when does the reaction occur? We do see people who come after bee sting and they have developed severe reaction. That is when, for some reason, for few people, this venom is identified as a very bad thing in their own body, and suddenly their innate immunity works. Okay, and they develop allergic reaction. That is, body thinks it to be like it's a small bee, but your body thinks like as if it's a king cobra. Okay, venom. For some reason, body, it's very protective. For some people, they have a very good immunity, but that can as well develop this way by a severe allergic reaction. That is when there is possibility of anaphylactic shock. Okay, that is because the hormones and the enzymes and the antihistamines produced in your body can itself lead to that, and it is not actually the bee which has caused that. Okay, so that is one reason. And the second reason when you would want a medical attention when it will be severe is when a swarm of bees attack you. Usually when you disturb a beehive, a swarm of bees come and bite more than 10, 20, 50. 100, okay, n number that way. So that is when the small amounts of venom accumulate in your body and grow to a certain extent where it can cause distress. Yes, that is a time when you would need medical attention. Otherwise, a single or a few honeybee bites would not cause any major concerns. Okay. However, there are few things that you can do. Sorry, previous slide. Okay. If it is a bee, wasp, or a hornet, first thing you have to remove the sting. If it is visible, please remove the sting. Okay, you can use tweezers, you can do use anything with which you can pluck it out, and then gently apply some pressure around that area. Okay, then move to a place where you have some water, wash it with soap and water, maybe even give some ice compression. Okay, and then apply some lotion, any cooling lotion, anything with calamine, anything with any moisturizer for that matter. If you apply, that soothes that place. Okay, you will be relieved of itching. And do not scratch, because whatever the venom is there, whatever the bleb is formed, when you scratch, it dissipates, okay, to other places. So that can cause much more severe reaction. So never itch that area. Okay, and as I said, if the severity is more due to allergic reaction, 100% immediate medical attention would be required. Okay, next slide. Fractures. Okay, whenever you see a person with fracture, first thing first, you see it either somebody has fallen, road traffic accident, it can be a fall from staircase, so it can be any of it. So first thing first, make sure you are not in danger. Okay, assess for the scene. Okay, and then go to the place, look at the person, what has happened. Don't move the patient immediately, because moving immediately without knowing which part is injured can dislocate or dislodge whatever is already fractured. Okay, we want to preserve the fracture as much as possible. If it is just fractured this much and you're trying to move, it might move this much, and that is not good. Okay, so please don't immobilize the patient immediately unless you have seen him. Once you have seen what is the injured part, support that part by providing a padding, okay, or a clean bandage, and only then please move the patient. In case of any active bleeding, we have already seen it in the previous slide. Apply gentle pressure on that site so that the bleeding stops, and then you can apply the clean bandage. Okay, never apply the bandage too tightly, because that can compromise the blood supply to the arm, and that is not good. When there is no good blood supply, the damage can be more bad. Okay, and then please bring the patient. In any case of fracture, there is no second thoughts. He will require medical assistance. It's just the first aid. If in case you happen to do all these things, that can lessen the damage that is caused. When you do it in a right way, it can actually be more beneficial once he comes to the medical facility. Right. Next slide. Choking. Somebody asked, I would want to know regarding choking. Okay. Choking, quite common, especially in kids and very senior people, where the swallowing reflexes are not that okay, because a child would have recently learned to swallow and then it can actually choke on something, or very elderly senior patients where there could be some nerve related issue where they tend to choke. Or it can happen with common people when they're speaking and no eating, it can go get dislodged into your, instead of your food pipe, it can go and get dislodged in your windpipe. Okay, so that is when somebody will have hard time in breathing. Okay, your lungs are fine, your upper airway is fine, but somewhere here you have something stuck. So your airflow is not good. There is no continuity. That is where you choke. You try to hold your neck because you're not able to breathe properly, like the first image that is seen. First thing first, encourage the person to cough it out. When you cough is a very aggressive way of body putting out the things that it does not want to keep within. It can be your sputum, or it can be these foreign bodies. Okay, try to encourage them to cough really hard, cough as many times as you can. Okay, if that is not working, second thing is go behind them, bend them slightly, and in between the shoulder blades, try to blow 5 blows on their back, okay, as hard as possible. They have to, your surface has to completely touch their back. It cannot be a hollow tap. Okay, like how you pat somebody, it's not that. It has to be a hard blow. Okay, where that force is also utilized to dislodge whatever is blocking your airway. Okay, but if the person is still choking in spite of all this will happen in a matter of few seconds to minutes. Okay, if you see that he is choking, then you need to provide something called as Hamlet's maneuver. Okay, most of you have heard this term, but not everyone is aware as to how to deliver that Hamlet's maneuver, right? So you're already behind this patient. Try to hold them close to their upper abdomen, okay? And then give a thrust, like hold your arm like this and give a thrust to the upper abdomen, where the person relatively jumps in front of you, because that is the amount of force that you're putting. Okay, it's an inward push, upward, inward and upward, so that it is just in your upper abdomen. Okay, you need to do that, and this will usually bring whatever is that choking the person would usually spit it out. Okay, in the kids it is relatively different depending on how small they are and others. If it's a very small child less than 1 year, and if it's as choked on something, you usually take the child by its leg and hang it invertedly and give some back thrust so that the child spits it out. Okay, in adults unfortunately we cannot do that because an adult is too huge. Okay, this is the effective way to deliver it. Okay, in spite of this, if it is not happening, there is something that I do not want you to do. Okay, choking, if you see something right inside the mouth, okay, which probably is accessible, maybe okay, but still I would not advocate it, because if there is a foreign body which they are choking on, you try to remove it by swiping your finger, that can actually push the object much deeper, which can worsen the situation. So please be careful. Unless you have a full visibility of it, do not try to blindly put in your finger and try to remove it. Okay, right. Next slide, please. Seizures. Okay, seizures, commonly known as fits to people. What exactly is seizure? Okay, seizure is nothing that your brain is having a burst of electrical activity. Okay, suddenly the electrical impulses that have to go in a certain way, like how I said, in your heart it has to beat in a particular rhythm. That is how the electrical activity occurs. The same way, even in the brain there are a lot of electrical activity that is happening. When that does not happen properly, when there are bursts of electrical activity that is happening, then it is called as seizure. Okay, what happens, like what can cause seizures? Your stroke can cause seizures. Any head injury, somebody has sustained injury to their head, they can have seizures. Somebody having an electrolyte difference, that is their sodium is high, low, their potassium is high, low, magnesium high, low, they can have sudden seizures. Or somebody is having a brain infection, more so called as meningitis, they can have. Or somebody who's already from their childhood having seizures for some reason, they can keep having seizures. Okay, this is just an abnormal outburst electrical activity in the brain. Okay, and how long does this seizure last? It's very brief. It is only for about half a second, that is 30 seconds to 2 minutes, that is half a minute to 2 minutes, that is 30 seconds to 2 minutes, that's all. Usually it does not last beyond that. Okay, and if in case a seizure happened to last for more than 5 minutes, then this is called as status epilepticus, where immediate medical attention is required. Otherwise, the person might have a permanent brain damage. Okay, but most of the seizure, irrespective of their type, they subside within this half a minute to 2 minutes. Okay, the time duration is very important because I'll come to it a little later. Okay, and let us go on as to what do we do. Okay, when we see a person as a first level responder, what do? I do not stop the seizure. I don't go hold his hand and legs very tightly. Hey, don't seizure, I'm holding your hand. No, this is something beyond your this. In case you happen to restrain that person, you might have a ruptured muscle, ruptured ligament, or a fractured bone also. Okay, so it is not advisable for anybody to hold a person when they are having a seizure. Okay, that can harm them more. Okay, however, it's going to subside within this span of time that I mentioned. So you can as well wait. But when you wait, what do you need to do? You need to do the scene safety for yourself and for the person. Are there any sharp objects around? Is there any knife, electric current wire, or is there some hard surface there where he could likely, when he is jerking, that he can sustain injury? Move all those objects far away. Okay, wait for the seizure to subside. Okay, once the seizure is subsided, once he stopped jerking, he has stopped doing those jerky movements, roll the person gently so that his he's upside down, that is his back has to come up and his front surface has to go down. Okay, that is called as a recovery position. Okay, because this allows whatever the saliva and other things that is accumulated, that can go and no, cause him to actually suffocate on his own saliva. So once you put him in that position, all that whatever is accumulated will actually come down so that his airway is patent. Okay. So this thing, but please do it once the seizure is subsided and not when he's actively having seizures. When he's actively having seizure, he'll be so stiff that if you try to put him in other place, he can actually injure himself. Okay. And if the seizures continue for more than 5 minutes, then, or if the person is having, it has occurred for 2 minutes, it has stopped, but within again 2-3 minutes he's developed seizure again and he's not responding. All these are signs when you will have to call for immediate medical help. Otherwise, usually a person who has had normal seizure activity subsided within 2 minutes, he might be in some confusion, but slowly he regains his conscious and then he tells you that he is fine. Then he can go and visit, or you can accompany him to visit the medical facility. Okay, but in case it continues like this, for more than 5 minutes, or if it's a recurrent seizure, then you will have to immediately get a medical help, right? Now, there are few myths that surround your fits. Somebody says, give him a metal key and the seizure will halt suddenly. By the time you go search your metal key and come and place it in his hand, it's already more than 30 seconds or 2 minutes. So automatically by then it would have stopped. So your metal key has no part whatsoever in stopping your seizure. It's a myth. Okay. Or also putting some powder, some gods, some deities powder and those things. Please don't do that. He can as well choke on that. Okay. Or putting some water into their mouth, thinking that giving water can relieve them for seizures. No, that does not happen. Okay, putting water more, they can actually, the water can trickle down to their lungs and they can get more worse. Okay, giving a key, putting some mantra, tantra powders, or putting some water into the mouth, definitely not advisable. That can cause more harm than good. Please keep this in mind. Okay, next thing. Next was choking, right? Choking is done. Seizure and trauma to the eye, right? Wonderful. So this is the last topic of the day, trauma to the eye. As ridiculous as this picture is seen, eye injuries can be very dangerous, okay? Maybe not life-threatening, but definitely vision-threatening, which is equivalent to life-threatening, because if you do not have a good vision, how good is our life, right? I mean, especially when we lose it, okay? Right? So prevent any injuries for that matter. Here, what I've seen is a physical damage with some stick or some metal piece or some other foreign body. Okay, when it falls to your eye, you are not supposed to rub your eye because that can cause more damage to your eye. Instead, what you do, you pull your lower eyelid down and see if there is any foreign body. Okay, if it's seen, if you think it's accessible, it's always worthwhile to twist a corner of your handkerchief and then wet it with some water and try to swipe that object if it is a very small speck of something. Okay, if it's some metal thing which is already embedded into the eyeball, like what you can see in this funny figure, okay, please do not touch it unless there is a doctor around. Okay, you're not supposed to touch it. The minute you relieve him from that, it can cause profuse bleeding. If he's not under medical attention, then what not, the life can be under no, there can be life threatening incident also. Okay, so please do not, if something is embedded. Recently we had, because there is a construction going on near our hospital, and a person had come who has had a through and through injury from his cornea to inside, and he had come here. And since we do not have an ophthalmologist right at the place for now, so we had to immediately just give a blood, a patch for the eye, and we had to send him over to the nearest ophthal facility where they are better, like they have better equipments where they can remove and suture wherever possible. Okay, so never go to remove the object. Just lower the eyelid, try to sweep if in case possible. If not, then please you can just not do any of that and take him to a medical facility. Okay, and in case there is any chemical injury, okay, like say some acid has fallen, some alkali, that is your detergents or your harpic, and those things have fallen, immediate thing is first to rinse your eyes. Take some water, rinse your eyes for at least 2 minutes. Let all the thing that is there get washed off. Okay, and then go to a doctor immediately. But first, even before going to a doctor, you need to rinse your eyes whenever it's a chemical injury. Okay, otherwise this can cause a permanent blindness, because that would have damaged your cornea and that would have caused opacity in your cornea and you can lose your vision. So immediate thing, rinse your eye. Okay, And do not put anything like hot oil, creams to your eye. Okay, many are fond of this. A small kid has some eye injury, put some hot oil. Please don't do that. If somebody has something else, put some powders, put some cream on that, everything will be okay. Please do not do that. That can cause more harm. Okay, right? And then after you rinse the eye, you please take him to the medical facility. Right. So the next slide. Okay. We are now in the end of our presentation. So I just have a small quiz. It's just a mini quiz. I would appreciate if all of you participate there. I can see that there are 64 of you. I'm very happy. Okay. So on the left side, what you have are the conditions. As a first level responder, what would you do for these conditions? And the options are given here. I would want you to match. Please, can a few of you please just see and match the right ones? Like, what do you do when you see a patient bleeding? Amongst these options, what would you do? Bleeding, elevate the feet. Sorry, Anup. Anup is right. Yes. First, what we do is we apply direct pressure. Okay. When somebody is bleeding, we apply direct pressure so that there is no bleeding. When there is fracture, we don't elevate feet. First thing with fracture is do not move the person. Do not move the limb. That is the first. Yes. Okay, that is wrong. For fracture, you do not move the limb, you keep the victim still. Okay, for choking, what do you do for choking? You give abdominal thrust. Wonderful, Tilak, thank you. If somebody is having a heart attack, what do you do? Wonderful, Himanshu. Right, keep the victim still for fracture. Wonderful. CPR, all of you are right. Okay, and when somebody is having a shock, what would you want to do? So there was a bit of confusion now, I see. For bleeding, people wanted to elevate feet. I would say you are still right, but that is not the first thing that I would do. I would always apply a direct pressure to halt that bleeding, right? And then in case a person is in shock, then I elevate his feet. Otherwise, there is no point in elevating the feet. Okay. So I think this was mistaken for when you have a wound, raise the body part. I think it was mistaken for that. But elevate your feet in this context mean that let the blood supply happen more better for your heart and the brain and other vital organs and not for the peripheries. Okay, wonderful, amazing. So now here is the answer to all of this. Okay, can you please change the slide? Okay, so I can see that all of you are right. 1 second. Okay, so now this is the only one and only take home message that I have. Okay, it is important for one to remain calm during this whole process. When you are being a first level responder, there's always a lot of stress on you. Am I doing right? Am I doing wrong? Yes, now I have listened to this Dr. Amrutha's class. I will be knowing something, but still, will I be able to effectively do it? Don't doubt yourself. I'm sure all of you will do it amazingly. Okay, but make sure that you remain very calm, composed. Okay, and then attend the emergency, like how we have gone through this webinar. You can follow all of it. They're all in very simple steps, but they can make a difference between life and death. Okay, and it will help you provide a better first aid until the professional help arrives. Okay, right.